I'm a member of the ISLC, the International Association of Study Lung Cancer, and the International Society of Liquid Biopsy task forces for liquid biopsies, and is our, I guess, our bias that with some scientific fundamentation that liquid biopsies should be used first, because basically you get the answer in 7 days, 7 to 9 days, you get the answer. In a lot of institutions, like a well-established cancer centers, you do your NGS in tissue, and yes, you can get the answer in less than 2 weeks, but that's not real life. 80% of the cancer patients are treated in the community. They are not treated in a major academic center. What happens in the community is you order a tissue biopsy, and most of the time it's not in your hospital, it's in a small community hospital where you don't have any authority to order the pathology technician to ship it right away. Sometimes only the shipping takes a week, takes 10 days, 2 weeks, and then the vendor gets the tissue and starts to do the NGS. That's why it's not a surprise that, for example, in our healthcare system, it's a big community healthcare system in Florida, takes 28 days. 28 days to get the result from NGS on a tissue biopsy, while we get the result in 9 days with a liquid biopsy. And we show in the paper that is in clinical lung cancer that 70% of the patients, 70% of the time, with the result of the liquid biopsy, we can establish what's the best treatment for the patient without waiting for the patient, making the patient wait 4 weeks. Or what other doctors do in the United States is they start empirically chemo while we wait for the results. But that's, we're doing precision medicine. Why don't have to do anything empirical anymore? So I know the patient doesn't want to wait. That's why the doctors give empirically some carboplatinum pemetrexed until they get the result. And if the patient has an actionable mutation, they put him in the actionable mutation. If not, they add immunotherapy. But I guess we can avoid that if we can do the liquid biopsy, at least in a large number of patients. As I said, 70% I think is a good number.